Well, COVID-19 new cases continue to drop in the country. New infections are now averaging below 2,000 a day, with Gauteng, the Western Cape and KwaZulu-Natal contributing over half of these. However, experts say the fourth wave is imminent in December. So to discuss this even further, we're now joined by Dr. Yogan Pillay from the Clinton Health Access Initiative, South Africa. Well, thank you so much for your time, Dr. Pillay, and good morning to you. The question I suppose we're also asking at the same time is then, how do we make sure that we bend the COVID-19, curve right in time for the December holidays? Because at times when we hear that we are on level 1 or level 2 lockdown, there tend to be a bit of relaxation and people tend to be, a bit relaxed when it comes to those regulations.
Good morning, and good morning to your viewers as well. No, absolutely. The good news is that we've now, in 6 of the 9 provinces, exited the third wave. But you're right. The prediction is that we are likely to have a fourth wave sometime early December. So we have about 8 weeks or so to prepare ourselves for the fourth wave, and in ways in which will blunt or bend the curves in the fourth wave, should we have one. And one of the key things we need to do in order not to be complacent is to ensure that we, one, practice all of the non-pharmaceutical interventions, and we know all of those things: hand washing, masking, social distancing, and good ventilation. And now that it's summer, we can keep our windows open, and more likely to do that than in winter. And the second is vaccination. Even though we've started the vaccination program late, I think we've done fairly well, but not good enough. Only 1 in 5 South Africans are fully vaccinated, meaning they've had 1 shot of the J&J vaccine or 2 of the Pfizer vaccine. Now we have to get to at least 3 out of 5, if not 4 out of 5 South Africans fully vaccinated by the end of November, early December this year. So we've got a long way to go in vaccination. And, I would encourage people, especially those who are 50 years and over, and those with underlying conditions like diabetes, hypertension, HIV, and TB, to get vaccinated as quickly as possible. Those are the key things we must do to ensure that the only wave we experience in December for those who are lucky enough to go to the beach are the waves at the beach, and not this fourth wave of the virus.
Right. Dr. Pillay, I think we've seen in this past year or almost 2 years the importance of, our healthcare workers. How do we protect them during this time?
Critical. I mean, that's really a number one question. And an article I wrote with my good friend, Dr. Bray, that's one of the 5 things we stress. We have a significant amount of healthcare workers now vaccinated. We'd like the rest of them to get vaccinated as well, because we know that protects from severe disease and also death, both healthcare workers, of course, and everybody else. The second is that we need to ensure that, we only go to our facilities when we are sick, but we have to encourage people to use our health facilities because it's safe to do so now. One of the key things moving towards the December holidays, we know that alcohol consumption goes up, the number of traffic accidents goes up, the number of interpersonal violence incidents go up, which means that our health facilities, especially our hospitals, get crowded with people who actually shouldn't be there. And they wouldn't be there if they took some responsibility over alcohol use, interpersonal violence, trauma, etc. So we can protect health workers in 2 ways. One is ensuring that the health managers take care of them. Secondly, that they get fully vaccinated, that we have all of the PPEs available. And of course, that the community at large takes responsibility for their health. And, we don't see the high level of trauma cases we typically see during long weekends, during holidays, and certainly during the December period.
An important point you mentioned in there, and you also referred to this, the article that you wrote alongside your very good friend, and part of the things that stood out for me was the advice you gave around seeking health care, even during a pandemic as this, because if the stats are correct here, HIV testing rates, they've declined by, approximately, or at least over 22%. So even though we're focusing on COVID-19, trying to ensure people are vaccinated and keeping safe by wearing masks, etc., you are saying it's equally important to ensure that we take care of any other ailments that need attention at this time.
No, absolutely. The tragedy of our country, of course, is that we have these 4 pandemics or epidemics going on at the same time. We have still high levels of HIV infection, In fact, we have about 200,000 new HIV infections every year in South Africa, and a significant proportion of them, of course, are women and adolescent girls and young women. So that's one tragedy. The second is we have about 400,000 new TB infections in our country every year. And about 150,000 of them are not known to the health system because they don't seek care either early or ever. And of course, we have about 5,000 people dying of breast and another 5,000 of cervical cancer every year. So we've got all of these, you can call them mini epidemics going on at the same time that we have the COVID pandemic going on. So we can't, only prioritize COVID. We've got to ensure that people who have all of these other conditions can get the health care they need.
Well, Dr. Pillay, I appreciate you talking to me this morning, highlighting very critical and important points there. Dr. Yogan Pillay, thank you so much for your time this morning.